Hey everyone, and welcome to my brand new channel for fact's sake. I'm Rohanti and I'm a medical doctor based in Australia, and I wanted to set off this channel with a super current topic, the coronavirus. So the coronavirus has been gaining a lot of traction over the last couple of weeks, and in that time we've had huge amounts of information through the news, through social media, and everyone's been talking about it. So I think it's really important that we take a minute to review the facts that we have about the virus so far. So let's get started. So coronaviruses are actually a group of viruses, and these viruses essentially consist of some genetic material wrapped up in an envelope with some protein spikes on top. And the way these protein spikes are arranged gives the virus a crown-like appearance. And corona in Latin means crown, so that's how the virus gets its name. So for a lot of you, this might have been the first time you've heard of the word coronavirus, but coronaviruses were first identified in the mid-1960s. And as of today, we actually know of 7 different types of coronaviruses. 4 of these are known human coronaviruses that are known to cause the common cold. So you may have even had a coronavirus when you had one of your common colds caught from someone else. But sometimes these coronaviruses that generally affect animals can evolve and infect humans and become a new human coronavirus that can jump from person to person. And we actually know of 3 examples of this type of coronavirus. The first one is the severe acute respiratory syndrome coronavirus. You may know it as SARS. So the first case of SARS was identified in China in 2002, and it actually caused a worldwide epidemic, infecting about 8,098 people and killing about 774 people. The last known case of SARS was sometime in 2004, and we haven't seen one since. The second example is the Middle East Respiratory Syndrome coronavirus, or the MERS. And this was first reported in Saudi Arabia in 2012, and it was thought to have originated from camels. Since then, there's been 2,494 confirmed cases of infection and 858 deaths that actually happened over 27 countries. And this data is as of November the 30th, 2019. The third example is the now popular 2019 novel coronavirus, appropriately named 2019 nCoV, and the first few cases were identified between the 30th and 31st of December 2019 in Wuhan City, China. And on January the 30th of 2020, the World Health Organization actually declared the 2019 novel coronavirus to be a global health emergency, given its quick spread and its reach. And as of February the 3rd, 2020, we've had 17,373 infected or confirmed cases. And of these, 17,190 have occurred in mainland China alone, with the rest occurring outside. For those of you watching in Australia, we've had 12 confirmed cases so far. And as of this date, the death toll is 362 deaths, with 361 of them happening in China, and the first ever death outside of China having taken place in the Philippines on February the 2nd. So from the information that I've told you so far, you probably recognize 2 things. The first one is that the number of infected cases for the 2019 coronavirus has already surpassed the number of infected cases of SARS and MERS. And second, that the ratio of deaths in comparison to the number of people who have been infected, known as the case fatality ratio, is actually a lot lower than the other 2 coronaviruses. But we need to remember that the data on the 2019 novel coronavirus is still very, very young, and infectious diseases experts usually believe that the initial numbers can be misleading and the rate at which the deaths occur can grow as the infection progresses. But we should also remember that we may be underestimating the number of people who are infected, maybe because they haven't had any symptoms or because they didn't present to the hospital and have the virus tested and confirmed. that actually means that the denominator of this case fatality ratio would be a lot bigger, and that means the number of deaths in proportion would be a lot smaller. Either way, we are going to need a lot more data before we can decide exactly how deadly this virus is. If you'd like to keep a track of the number of infected cases around the world, look for the link in my description, which will take you to the Johns Hopkins live map of infected cases. The symptoms of the 2019 coronavirus are pretty similar to those of the flu. So the most common ones reported are fever, cough, and shortness of breath, among others, which include fatigue or muscle tightness, headaches, a runny nose, and sore throat. The people that develop shortness of breath do so because they've developed pneumonia, which is inflammation of the small air sacs in the lungs, known as alveoli. And pneumonia can be mild or it can be severe depending on the person. It's usually critical when it happens in really young children or people above the age of 65, or if a person has a compromised immune system. But things really start to get ugly when the person goes on to develop acute respiratory distress syndrome, or ARDS. Now, ARDS is where there's fluid buildup in the alveoli, and that actually lessens the amount of oxygen that can get into the bloodstream and go to your organs. Now, this is a super serious condition and it needs hospital admission and intensive care. A recent article published in The Lancet, one of the most reputed medical journals, actually reported that about 30% of people who develop shortness of breath end up developing ARDS, and about 15% of these people actually end up dying. But we need to take these numbers with a pinch of salt because this study in The Lancet only included 41 patients, and they were people who presented to the hospital for admission. So, they were already a part of the really sick to get into the hospital group. Initially, the virus was identified in people who had visited this particular animal market in Wuhan City, China, where the infection was thought to have originated from. And then they found the infection in people who had never visited that animal market. And in the last week, they've confirmed the infection in people who had never traveled to China. So what does that mean? It means that we now have evidence that the virus can be transmitted from person to person. So it appears at this moment that the virus is transmitted through a respiratory route. So most of the preventive measures offered by health bodies like the World Health Organization is prevention of droplet spread infection. So any infections that are spread through a cough or a sneeze. Now, there's two important things that you need to know about the actual spread of the infections. We've seen reports that tell us that you can get the infection from someone even if they don't have the symptoms of the infection. And two, you can also get the infection from people who, before they've had their symptoms, if they go on to develop symptoms, and after they've recovered from the symptoms, if they've had the symptoms as well. And at the moment, it's estimated that the time between catching the virus and developing the symptoms can range anywhere between 2 days up to 14 days. So basic hygiene practices go a long way in protecting yourself from the 2019 coronavirus infection. So that includes regularly washing your hands with soap and water or cleaning your hands with an alcohol-based rub, coughing or sneezing into a tissue and then throwing the tissue away immediately and washing your hands after it, avoiding close contact with anyone who has a fever or a cough or similar symptoms, and also avoiding close contact with people who might have traveled to China recently or come into contact with someone who might have traveled to China. Avoiding big crowds is also a good idea, as well as live animal markets, considering that the virus is thought to have come from an animal. And also avoiding eating raw or undercooked meat, and following good food safety practices when handling raw meat. You can use a medical mask, which can limit the spread of infection, but wearing a mask alone doesn't guarantee your protection. You still have to follow those basic hygiene practices to ensure it. At the moment, there is still no vaccination for the 2019 novel coronavirus. So at the moment, the general recommendation is if you develop mild symptoms like a cough or a sore throat, step 1, don't panic, and step 2, don't go to a healthcare facility immediately. And I know that sounds ironic, but here's the thing. Given that the infection can be benign, going to a healthcare facility or another place where there's a group of people can mean that you can spread the infection to others, or if you don't have the coronavirus and you have something else like the common cold, people with coronavirus around in those groups can give it to you. So it works both ways. If you do have symptoms and you're concerned about them, contact your local health practice, your GP or hospital, and ask them for advice. Based on the severity of your symptoms and your possible contact history, they can give you guidance on whether you just need to stay at home and isolate yourself and observe your symptoms, or if you need to come into the hospital to get admitted. So as of today, the treatment for the 2019 novel coronavirus is supportive therapy. So that means if someone's having difficulty breathing, you may have to put them on a ventilator. If they're dehydrated, we may have to give them fluids. And if they've got a fever, we've got to bring their temperature down. Basically, keep them supported until the illness has run its course. So to recap, the 2019 novel coronavirus is a new pandemic infection, but it's one of the 7 coronaviruses known to date. The number of infected cases has surpassed the known cases of SARS and MERS, but the number of deaths in proportion to the number infected is actually much lower in comparison. And we also need to remember that the number of infected cases with the 2019 coronavirus is actually far less than some of the flu pandemics we've seen in the past, like the H1N1 or swine flu pandemic in 2009, which actually infected 60.8 million people in the space of 1 year. So yes, it's a new infection, and yes, there's a lot more information to come, but it isn't the worst that we've had so far, and it's definitely not the end of the world yet. So stay safe, stay optimistic, and don't panic. If you'd like to check out some of the scientific sources I've used for the information in this video, click on the link in the description called References Document. Do it, for fact's sake.